This is the second part of our adult physical exam. We are going to start with the GIGU exam. We'll have you go ahead and lay down. During this exam, you're going to inspect, auscultate, and palpate. You're going to look at the abdomen. You're going to inspect any areas of old scarring, any distension of the bladder. You're going to auscultate bowel sounds in all four quads. Technically, you're supposed to auscultate for a period of 5 minutes to make sure you hear proper sounds. You're going to also palpate for tenderness in the abdomen area. You can check the liver is on the right, the spleen is on the left. Current sign, if you press down on the area of the spleen, you're going to get referred pain up to the left shoulder. To check for appendicitis, you're going to push at McBurney's point. You're going to get rebound pain, which is pain when you let go of it. At this point, you can also check for any distension of the bladder and femoral pulses. Let me sit up. We're going to look at the musculoskeletal. We're going to inspect, palpate, and percuss. During the exam throughout, you're going to look at posture. You can look at gait as they come in. You can do the Romberg test. Let me stand up. The Romberg test is where you have them stand up and close your eyes. And if they sway either way, okay, that's good. That's part of balance you can look at. You're going to look for range of motion and muscle tone. So bilaterally, you're going to look and see if there's symmetry, muscle tone in all the extremities, upper and lower extremities. You can test range of motion in all joints. And you can also do it on the legs and the ankles, the feet, bilaterally. You're going to check for muscle strength and tone. So your hands up and push out, and in, and up, and down, and legs push against me, back, down, out, and in. Good. For the neck and shoulder area, you're going to look at cranial nerve number 2. So you can hold your hand here, and have them look away. Good. Good. We've already inspected the spine. Most commonly in older adults, they'll have lordosis, which is the leaning over, or excuse me, kyphosis, and lordosis is the lower back. You can also check for scoliosis, which is usually found in younger children. But it is still possible for adults to have that as well. For the neuro exam, you're going to check for mental status. You can check that when they come in the room as well and throughout the whole exam. You can ask them what day it is, what month it is, year, who the president is. Cranial nerves we've done throughout the exam include motor, sensory, gait, and you can check for deep tendon reflexes. You can do it in the arms, right at the knee, and right at the foot or behind the Achilles area, and the ankle area. Skin you look at throughout the whole exam. You're looking for color, texture. On older adults, you can look for skin tears, bruising, and you're going to look at skin turgor to see if they have good hydration. It will go right back if they're well hydrated. You can look at edema in the extremities as well. Usually in the feet, the ankles are very common for the older adult to have swelling or edema. And then you look at their hair and nails throughout. Make sure it's healthy, skin color is good. Their nails looks at oxygenation and cardiac output. You can check for capillary refill to make sure they refill, that there's no pitting or clubbing on the nails as well. And concludes our exam.